Ens4Care is a thematic network financed by the European Commission, especially DG Connect, and the aim of the project is to develop evidence-based guidelines for nursing and social care services, e-health services. It is coordinated by the European Federation of Nurses, together with a consortium of 24 partners. These partners have been playing a crucial role in developing these evidence-based guidelines, because we have first collected from the field, from the daily practice, these guidelines, these projects which exist in EU member states.
The role of my organization in this project was to bring the citizens and the patients' point of view at the same level of the point of view of professionals such as nurses, social workers and other relevant stakeholders.
We're really interested in how we can get the world's 19 million nurses to focus on prevention. This would make such a difference to health across the world.
When you're challenged by health or disability and you need complex care services, you need to have up-to-date information about the kind of treatment that you can receive and the models of care that may be available.
Our particular focus is on clinical practice, supporting nurses and social workers in actually working with e-health technologies for the benefit of patients and citizens.
My role in Ens4Care is to give the opinion, the position of GPs in Europe in the circle of health professional and citizen around the question of ICT.
I would like to help with the implementation of the guidelines in Bulgaria. So it will be very nice to have the chance to see the whole process and to implement them in Bulgaria.
That is relevant to work together with different stakeholders such as citizens, patients, and many other relevant stakeholders.
It's been a real pleasure for me and my organisation C3 Collaborating for Health to have had the opportunity to lead on the work package on prevention and also to be able to engage with nurses from across the EU, working together. The work package leaders particularly formed a very solid team supporting each other as we worked our way through the development of the guidelines, and it's been particularly interesting and useful, I think, to engage with many of our colleagues from Eastern European countries.
It's been quite amazing, actually, quite a travel to participate in the Ens4Care. What I think has been extremely important is that we've quite easily selected more than 120 practices that shows that e-health technologies are being used in Europe.
I am feeling in this circle of colleagues in a very good situation of collaboration.
I feel very excited to have the chance to work for Ens4Care, because we had the chance to share good practices coming from the community.
We have selected 120 ongoing practices already, which are empowering patients and are cost effectiveness. We did not develop new things, we just brought together the existing practices, and based on these existing practices we upscaled a guideline in order for other regions in the European Union to deploy these e-health services.
With the prevention guidelines, any member of the public could look at the guidelines and have added insight into what they can do for themselves and for their families and in their local communities.
For too long, social workers and nurses have worked separately in their own silos. The Ens4Care network harnesses the power of the internet to make available information to people. It also brings the possibility that people are treated properly and given full control over what is happening to them.
it recognises that not only does the carer need information and training and support, but equally that the professions need to change their mode of operating, and that they also need training and information as well. So that mutuality is very encouraging, because in the past it tended to be the professions saying, well, the carer needs this and the carer needs to do that.
Apps will be used in order for citizens to change their lifestyle, to do more activity. In the clinical practice, we have a clinical practice on COPD, that in those member states, in those clinical settings where there is no existing guideline already on e-health services in COPD, the guideline of Ens4Care will help the nurses and the social care workers to develop something at local site.
We find that carers within the home are very, very receptive to the use of technology, because they see it as an aid, as a support to them. And they also see it as a way of linking with a key profession, because quite often the carer will feel isolated within the home on their own with this huge burden of responsibility to their relative, without someone to be able to turn to in an emergency.
Every individual, every patient all over Europe, especially in the Eastern European countries, can be empowered. In one word, I can say that Ens4Care is hope and success.
Prevention, education, and patients empowerment.
Contribution.
Power to the people, not the professionals.
Innovation.
Interprofessional collaboration.
Health system reform.